Hello everyone and welcome to my health and wellness channel. I'm Dr. Gauri Bhede and I'm a medical oncologist, which means that I'm the kind of doctor who treats patients with cancer. Because my patients take so many vitamins and supplements on the side, I decided to do a review of all the vitamins and supplements that people commonly take, and I'm presenting an overview of the literature search that I have done. During the COVID-19 stay-at-home lockdown, my two teenage sons were responsible for making their own lunches as I had to work and they had to be self-sufficient. So, believe it or not, the frozen chicken nuggets became their mainstay. And in order to balance out their diet a little bit, I insisted that they eat carrots because both for their veggies as well as to maintain their eye health. So they cackled and they said, "Mom, don't you know that the carrots being good for your eye health was a myth propagated by the British Royal Air Force?" And I said, "No, not at all. Carrots contain vitamin E, vitamin A, and they're really good for your eyes." So we went and did a little search, and I did find this on the Smithsonian Magazine website. During the World War II blitzkrieg, when the Germans were trying to bomb the British countryside, the British had a countrywide blackout to thwart the German bombers. But in addition to that, they had also developed a secret weapon called the Onboard Airborne Interception Radar. And this helped the RAF pinpoint the bombers before they crossed over the English Channel. Now, the Germans were baffled as to how the British were able to accomplish this, and the British didn't want to give away that they had the secret weapons, so they promulgated this myth that the British pilots' night vision was so superior because they were eating their carrots. Now, there was already a body of literature and newspaper and magazine write-ups that vitamin A deficiency causes vision problems, and that was already making the leap that megadosing with vitamin A helped night vision. That being said, carrots do contain a generous amount of vitamin A per serving of only 1/2 cup of raw carrots. And to get the equivalent amount from French vanilla ice cream, you would need to eat 2 cups. I'm not telling my sons that because I know what they would choose. Besides the well-known benefits to vision, which we'll talk about in a minute, this group of substances called retinoids dramatically contributed to the treatment of leukemias. Acute myelogenous leukemia is a group of very deadly leukemias which need heavy-duty chemotherapy to combat it. And there's a subset called promyelocytic leukemia, which also causes life-threatening bleeding. And a lot of people die in the time frame that it takes to diagnose and then to get started on the chemotherapy. In the 1980s in China, there was a group of scientists who had discovered that a version of this retinoic acid called all-trans retinoic acid, or ATRA, when it was treating cancer cells in a petri dish, was helping the immature cells mature. And they had time and resource constraints, so they took the leap and started treating promyelocytic leukemia patients. And lo and behold, they found that the immature cells started maturing into mature cells. Now, unfortunately, this was not a permanent effect, and they still needed to follow up with regular chemotherapy, but it certainly bought them time from diagnosis to treatment to prevent the bleeding complications, and it dramatically improved the survival rates. Retinoic acid and carotenoids have several other therapeutic uses. Of note, vitamin A treatment of children with measles in endemically deficient vitamin A areas reduces complications and mortality related to measles. This is an important piece of information to put in your back pocket as the number of measles cases rise even in the developed world because of the lack of vaccination. And because carotenoids are antioxidants, they were also investigated for possible prevention of cardiovascular disease. Unfortunately, randomized trials of vitamin A and beta carotene showed no benefit in cardiovascular disease prevention. And in fact, there's even some evidence that beta carotene supplementation may increase the mortality from cardiovascular disease and may increase the risk of lung cancer. What does vitamin A do for the eyes? It is an essential building block for an important group of proteins in the eye called retinol binding proteins. It is also very important in the normal development and functioning of the conjunctiva and cornea. Deficiency of vitamin A is very common in malnourished populations, and unfortunately, worldwide, it's present in about 30% of children under 5. In fact, in the sub-Saharan Africa and South Asia, that number is almost 50%. And almost 500,000 preschool children become blind each year from vitamin A deficiency. Mass supplementations in these populations has made a significant impact on the eye complications of vitamin A deficiency. But surprisingly, it has also decreased hearing loss in those children who also have an ear discharge, which is indicative of an ear infection. Another group of eye diseases associated with vitamin A deficiency is a condition called xerophthalmia. In this, the tear glands do not produce enough moisture, and it causes severe dry eyes and damage to the cornea and retina. And this condition can be reversed if caught early with vitamin A. Deficiency of vitamin A is rarely seen in well-nourished populations unless you also had fat malabsorption, because it's a fat-soluble vitamin and it requires the ability to absorb fat. And this fat malabsorption can be seen in conditions like Crohn's disease or celiac disease, and may also be seen in pancreatic or liver diseases. Deficiency of vitamin A can cause skin problems, destruction of hair follicles, poor bone growth, and also immunity problems. It is important for the normal development and functioning of the heart, the kidneys, the lungs, among other organs. Because our bodies don't manufacture vitamins, they need to be consumed. There are two forms of vitamin A. The first is provitamin A or beta carotene, which is obtained from plant sources like green leafy vegetables, sweet potatoes, and of course, carrots. The provitamin A needs to be metabolized into active vitamin A. And since this process is regulated internally, you cannot get toxic amounts of vitamin A from vegetable sources. However, individuals who consume large amounts of provitamin A may develop a yellow-tinged skin, which is a condition called carotenemia. Carotenemia is particularly common among infants and toddlers who are eating large amounts of pureed vegetables, particularly green leafy vegetables and carrots. And this skin discoloration can be confused with jaundice. It does resolve spontaneously when you reduce the intake of these foods. The second is preformed vitamin A or retinols, which are obtained from animal sources like liver, kidneys, egg yolks, and butter. They don't need activation, but you can eat too much of this and is much more likely to cause chronic toxicity if you consume more than 10 to 20 times the recommended daily allowance. This can show up as alopecia or hair loss, ataxia or motor and balance difficulties, bone and muscle pain, and liver toxicity. Since vitamin A is a fat-soluble retinoid, the liver is where more than half of our body's vitamin A is stored, and this can reach toxic levels. There are other carotenoids like lycopene found in tomatoes, which are not converted to vitamin A. So how do I get my vitamin A? From carrots, of course. I hope you found this information useful. Do subscribe, as there is more useful information on health and wellness coming your way. Stay in good health and take care.